My name is Geoff. I'm a senior staff data scientist on the AQMed team. I've been at Sandbox for 3.5 years. I work at the intersection of physics and data science, and really understanding the signals that come off medical devices and prepare them so that they can be used in machine learning classifiers to make diagnostic predictions. So I'm trained as a physicist in precision measurement. That's what I did my PhD in. I studied ultra-cold molecular interactions. And from there, I learned a lot about measurement techniques and how to measure things really precisely. And so I evolved from there to do precision magnetometry in a lot of different real-world applications like batteries, humans, even plants. And I really loved that idea of taking something that was developed in a lab and really applying it to real-world applications and understanding the world around us through these really minute fluctuations in the magnetic field. And yeah, that kind of naturally led to working more towards medical devices, where we're really trying to parse out the tiny little signals that can tell us a lot about what's going on underneath the surface. The Sandbox magnetocardiography device, the way it works is it measures the magnetic fields that are emanating from your heart every time it beats. There's electrical signaling, and there's associated magnetic fields that arise from that. And we pick up on those really tiny magnetic fields as they come out of your chest in a very similar way that like an EKG might pick up on the electrical signals that are sitting on your chest specifically. And the challenge with that is those signals are so small, and we're also measuring everything else that's in the hospital, for example. So even the cell phone in the nurse's pocket, the MRI machine in the floor above, the elevators across the hallway, or even the electricity flowing in the wall, everything gets picked up by our sensors. And so the big challenge with MCG is to be able to separate out which signals came from the heart, those are the ones that contain the diagnostic information, and which signals came from everything else, and how do we separate that? So MCG is a pretty old technology. It's been around since maybe the late 60s, early 70s. For a long time, MCG was typically done using large cryogenic devices. So they required liquid helium, which was very expensive. They also typically required a shielded chamber, which means that rather than deal with the ambient magnetic noise, you build a chamber that blocks it all out, which provides amazing signal to noise and really established a science of what those magnetic fields from the heart mean. But it wasn't really practical. And so what we're doing at Sandbox is we're taking that technology outside of those shielded rooms, outside of that cryogenic landscape, where it can be really used in hospital settings. That fits into the workflow of doctors and physicians and nurses who need to see what's going on in a patient's heart without moving them out of their hospital beds, without moving them into a new room or something like that. So when a patient is undergoing a heart attack, a lot of things need to happen very quickly. And physicians want to be able to understand what's going on as quickly as possible so that they can make the right decision. At the same time, they have to make sure that the patient is always being monitored and the patient is safe, right? So that in many ways that rules out going into another part of the hospital maybe, or rules out having to go into a special type of room. And so what the Sandbox MCG device, what we aim to do is to be able to bring the device to the patient, do a quick scan where they don't have to get out of their bed. They don't have to take off all other equipment that's monitoring them. We can scan it and provide the physician with the information they need to make a complete decision about what kind of care that patient needs when they're feeling that chest pain, when they're exhibiting symptoms that could be of a very serious heart attack. So when we want to separate out the signal from the heart from the signal coming from everything else, what we do here, which I think is really special, is that we really inform our algorithms with the physics of magnetic fields. So by understanding how magnetic fields propagate through space based on where they're generated, we can train our algorithms to be really clever about understanding what is it about magnetic fields that are nearby versus those that are far away that's different, And that really helps us to effectively separate those really cleanly. And in doing so, we can then see a clear signature of the heart. And every person's heart is so different and beats in such a unique way. It's really important that we can see that with really high signal to noise. Be able to pick out those fine details that would be able to tell a doctor that somebody really needs to get treatment right away, or maybe they can be managed with medicines, or maybe they can go see a cardiologist a little bit later on. Yeah, there was a patient that came into the hospital in New York. I think it was maybe a 65-year-old male who was exhibiting chest pain, and when they looked at the EKG, everything looked normal. They had slightly elevated troponin, so that's a blood biomarker. It wasn't so alarming, and so the physicians were really on the fence about whether they should send them in for a more detailed coronary angiogram. However, because the patient had a medical history that indicated that they had past cardiac events, they decided, let's stay on the safe side. Send them in. And before sending them in to the angiogram, the patient consented to getting scanned on our device, which we were very grateful for. And it turns out that patient had a very serious blockage in one of the main arteries in the heart. And it was really good that they were able to go in for the angiogram, because the physician was able to clear the occlusion, and the patient did well after that procedure. What we really like about this story is that when we looked at the MCG and analyzed the data, it clearly predicted that this patient would have occlusion in at least one artery, a major occlusion there. And that was exactly what happened. They had that big occlusion in a main artery of their heart. And so when we think about this patient, we think about how the physician could have come to a faster conclusion, or even if it was the same amount of time, a more definitive conclusion that yes, this patient definitely should go in for a procedure, instead of sort of relying on, yeah, everything looks fine, but maybe we should just err on the safe side. I think we all want to have the certainty in medicine, and probably that's impossible to be 100% certain, but every tool that we can provide that gives physicians a better handle on what's happening, I think could be really helpful.